A mental health crisis is tough enough without patients having to battle insurance companies for the care they need. In fact, there are federal and state laws that require coverage for mental health care. Despite this, Montana PBS's Anna Rao found some Montanans, especially patients with eating disorders, are still struggling to have their needs met.
For more than 40 years, Yvonne Field struggled with an undiagnosed eating disorder.
I didn't realize how messed up my relationship was with food.
Field also wasn't aware that eating disorders come in all shapes and sizes.
Because I'm in a larger body, for a lot of my adult life, I had medical providers telling me to lose weight and to go on restricted calorie diets. So I've gone through quite a bit of weight cycling, and one aspect of my eating disorder is that, I can be really restrictive in what I eat. I over-exercised for a period of time, and I was doing really intense exercise, trail running and ultra running. And so the amount of stuff that I had to do eating disorder behavior-wise to get my body in that state, to lose weight and or to maintain it is pretty extreme.
Field became so obsessed with her weight that she began to realize she had a problem.
An eating disorder looks like constantly thinking about food, constantly thinking about what you want to eat, what you don't want to eat, what you shouldn't eat. It is so disruptive in your life. And to the point where now you're isolating, you're not going out with your friends because you feel bad in your body, or you're not participating in activities because there might be food there.
Registered dietitian Paige Redden was one of the first people Field met when she reached out to the Eating Disorder Center in Bozeman. The center has roughly 60 clients receiving services at any given time. Redden and the therapists here helped Field to see her unhealthy relationship with food, and they helped her to uncover the real source of her pain.
There's a whole spectrum of behaviors that are used to help manage food, manipulate the body, because underlying all of that is the anxiety and the depression and the trauma.
When you have something really bad happen to you, when you're 9 years old when that happens, you think it's your fault and you think it makes you bad. And so the diet industry and my medical providers saying, hey, we don't like your body either. That was just, a thing for me that really helped my eating disorder be like, hey, let me step in, and they're punishing you for that, and you can punish you for that too.
Eating disorders are a mental health disorder. We have a lion's share of folks with sexual assault, traumas of neglect and abuse as children.
Jenny Gachen is the clinical director at the Eating Disorder Center. She says it surprises most people to learn that eating disorders are rooted in an additional mental health diagnosis, like depression or anxiety. And that double whammy makes an eating disorder extremely serious.
They are the second most fatal of mental health disorders after opioid addiction. And anorexia nervosa has the highest rate of suicidality of all suicides.
People often think that the food piece is the piece that has to be kind of tackled and conquered, and it is initially, but it's really the mental health piece that is what's underneath the eating disorder to begin with, and that takes a long time. It takes a lot of support.
And this is where insurance coverage can get dicey. Redden and Gachen say some insurance companies balk when treatment morphs from stabilizing the patient physically to actually treating the underlying mental health disorder. Field knows all about coverage denials. She's had 3 different insurance companies since she started treatment. One of them was great. The other 2...
They tried to deny coverage to even go at all to treatment. At a certain point, they said, you're cut off. We don't think you need care. It actually causes a lot of mental anguish and difficulty And if you're also somebody who struggles to believe that you deserve care, that kind of message coming from an insurance company is really hard.
It's devastating for patients that are working so hard to have an insurance say, you're actually well now, that we think you're well.
Is that legal? Can they do that?
I don't know if it's legal or not, but they do it. It's done all the time.
You need to follow the law. So, if you're not following the law, it's probably a violation and it would be a problem.
David Docks is the Insurance Services Bureau Chief at the Montana Commissioner of Securities and Insurance. He says it's possible that some denials are running afoul of what's known as mental health parity.
It's really making sure mental health services and addiction, substance abuse disorder services are provided on the same basis as medical surgical.
Mental health parity is a federal law that's been on the books for 17 years. It applies to all mental health disorders and treatments, not just eating disorders. So that includes bipolar, schizophrenia, and even autism spectrum disorder. In 2010, the Affordable Care Act, or ACA, significantly expanded and strengthened mental health parity.
If someone's not going to limit the number of times that you can be seen by your provider to treat your diabetes, then they shouldn't be limiting the number of times that you can see your provider to take care of your mental health.
Former state representative and mental health advocate Lori Bishop says it just makes sense for insurance companies to cover mental health treatment. Despite this, Bishop was concerned that the federal laws on parity were too tenuous, with opponents of the ACA constantly threatening to repeal it. So in 2017, she introduced a bill to make mental health parity a state law as well.
To make sure that regardless of what happens at the federal level, we're going to hold the floor under the protections for as many Montanans as we can.
Bishop says her bill looked dead many times, but they always managed to revive it. The legislation squeaked through the House by a single vote.
When I went to him and said, thank you, and wow, I'm just so curious on what changed your mind, he said, it was a call last night from somebody in my district who just let me know how important this was. And that right there helped me understand the importance of people calling. That personal encouragement made the difference on that day. And if it were not for that, we would not be sitting here talking about it.
Bishop was elated. Mental health parity was now a state law on top of the federal requirements. But the elation wouldn't last.
Even since parity has gone into place, continue to hear from people that they struggle. And I will say it was really in regards to eating disorders that not the exclusive conversation, but where we were seeing a lot of that need.
Since eating disorders have both a physical and mental treatment plan, they are well positioned to reveal any discrepancies in coverage between the two. And while Bishop initially heard complaints from constituents demanding parity when the law was new in 2017, over the years, the knowledge has faded.
Do you think people know that insurance companies are required to cover their mental health treatment the same way they would cover medical surgical?
I don't think people know that at all.
It is infrequent for people to really push back. They might try an initial call to their insurance company, but a lot of data tells us that people hit these walls or they get denied and they just don't have the bandwidth, don't have the capacity, don't know who to call in order to get the support to get to the yes instead of the no. And so oftentimes the no is what sticks.
A 2023 congressional report found 76 clear violations of the mental health parity law among a group of insurance companies during a 1.5-year time period. On top of that, investigators also say many insurance companies were providing insufficient data to prove they are complying with the law. In Montana, the commissioner recently began requiring insurance companies to provide data here about mental health parity. But no one in the commissioner's office is drilling down into the data yet to see if there are any problems.
How often do you think they just take that no and think that's the end of it and they don't get the coverage or they don't complain to you guys?
I think probably fairly often would be my guess.
Just 2 complaints over mental health parity have been filed in the last 2.5 years with the Commissioner's Office. One complaint was found not to be a violation. The other was against an insurance company the Commissioner has no jurisdiction over. Docs says this office does have teeth. If they discover an insurance company is violating parity laws, the Commissioner can suspend or revoke licenses and even levy fines.
As regulators, we recognize, there's a real disparity between the policyholder and a sophisticated insurance company that has lots of resources versus you kind of have this unilateral contract, you take the terms, that's what you have. So I do think it's important to have regulation of that industry to protect those consumers.
Little pieces of cauliflower.
Consumers like Field, who keeps on fighting despite the difficulties and the denials.
It's kind of steeled her into knowing, wait a minute, I'm the one doing the hard work. I deserve coverage.
And it wasn't a choice that I've ever made in my life to have an eating disorder or to be harmed to the extent that I need this care. So I wish they could understand the effect it has on people when they deny and when you're because for me, getting treatment and getting the right treatment feels like reparations for what happened to me when I was 9. Actually having somebody say, yeah, that's important for you to be able to heal your PTSD, to heal your trauma, to heal your eating disorder, and to then have a better life and be able to live without that pain and sorrow. That's the real use of that insurance, right? And I think I deserve that.
Field says she knows many other patients deserve coverage as well. She's hoping her story will encourage them to appeal denials and file complaints. Because despite the laws, you have to be your own advocate for now. For Impact, I'm Anna Rao.
In September, the Biden administration announced a federal rule that requires insurance companies to assess their out-of-network charges for mental health treatment to ensure they are no more onerous than those for physical care. The rule also extended mental health parity to state and government plans that had not been covered before.